types of the skull vault fractures. So looking at the types of the skull vault fractures, questions are: what is a fissured or the linear fracture? Next, what is a pond fracture? And lastly, what is a ring fracture? So we'll learn these questions. So firstly, we will look at the diastatic fracture. So diastatic fracture or the sutural fracture. So this basically it involves the separation due to a blow. And this is nothing but with a blunt weapon. Blow due to a blunt weapon or from the cerebral edema. Next, what we are looking at is the fissured fracture. So fissured fracture or the linear fracture. So here they are nothing but breaks in the bone. So they traverse the full thickness. So it traverses the full thickness of the skull, and this is from the outer to the inner table. Next is that it is usually fairly straight. And there is no bone displacement. Next, what we are looking at is the common cause of injury. So in case of the common cause of injury, so this includes a blunt force trauma. So this is where an impact energy. So the impact energy is transferred over a wide area of the skull. Next, we look at the pond fracture. So in case of the pond fracture or the indented fracture, so this it occurs in case of the children, and this is mainly due to the elasticity of the bones. Then we move on to the depressed fracture as well as the known as the signature fracture. So it is caused by a heavy weapon. And with a small striking surface. It has a small striking surface. And looking at the shape indicates the type of weapon which is produced. And this is nothing but the signature fracture. Next, we look at the comminuted fracture. So comminuted fracture, also known as a spider web. Comminuted fracture, the spider web fracture, it is nothing but a stellate appearance. There is stellate appearance where there is no displacement. Of the fracture. Next what we see is a ring fracture. So ring fracture is basically seen due to a fall from height. Fall from height and landing on feet. So these occur in the posterior fossa around the foramen magnum. So now to answer our questions. The first question we asked was what is fissured? What is fissured fracture as well as what is linear fracture? So fissured or linear fractures, they are nothing but they are breaks. Breaks in bone that traverse the full thickness. It traverses the full thickness of the skull. And this is nothing but from the outer to the inner table. Next is that they are usually fairly straight. So they are usually fairly straight with no bony displacement. Next, the common cause of injury. The common cause of injury is nothing but a blunt force trauma. So here what happens is that the impact energy is transferred over a wide area. So it is transferred a wide area of the skull. Next question we asked was what is the pond fracture or the indented fracture? So the pond fracture, the indented fracture, it occurs in case of the children, and this is due to the elasticity of bones. The last question we asked was what is a ring fracture? So a ring fracture is usually it is caused due to the fall from the height. So it is fall from height and where the individual lands on feet. So these occur in the posterior fossa. They occur in case of the posterior fossa and it is around the foramen magnum.